Hello, everyone. Thanks for joining us. I'm Cameron Friesen, Minister for Health, Seniors, and Active Living for the province of Manitoba. I am here with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, for our Monday briefing, and so we'll turn things over at this time to Dr. Roussin.
Thanks, Minister. Good afternoon. The current 5-day COVID-19 test positivity rate is 1.4%. 21 new cases of the virus have been identified as of 9:30 a.m. today, bringing the total number of cases in Manitoba to 1,449. There was one case in Interlake Eastern Health Region, 3 cases in Southern Health Region, and 17 cases in the Winnipeg Health Region. I want to note some changes to our regional counts following detailed public health investigations. One case announced on Sunday has been reassigned from Northern Health Region to the Winnipeg Health Region, and these changes are reflected in the data posted online. Related to this, I want to remind Manitobans that our data is based on the address on your health card, so if you had recently moved, it's good to update the address on your health card. Information on that health card is how we update our department's website, and how to update that address is available on the health department's website or by calling Manitoba Government Inquiry. More data from today: 257 active cases, 1,176 individuals have recovered. There are 12 people currently in hospital, 3 of which are in intensive care, and the number of deaths due to COVID-19 remains at 16. Lab tests show 1,514 tests were completed on Friday, 1,433 completed on Saturday, and 1,049 were completed on Sunday, bringing our total to 155,803. Today, we're announcing the possible exposure to COVID-19 may have taken place at Beaver Lodge School, 6691 Rannoch Avenue, and that was on Thursday, September 10th, morning and afternoon. The individual was asymptomatic at the time and followed all public health measures. This was not acquired at school. The school community and cohorts were informed. Necessary cleaning has been undertaken. There have been some people identified as close contacts, and they've been identified and advised to self-isolate for 14 days. In addition, we reported the following sites over the weekend: École New Era in school in Brandon, the Carberry Plain Health Center, 2 bus routes on Winnipeg Transit, the Ibex restaurant in Winnipeg, Smitty's restaurant on St. James Street in Winnipeg, Daniel McIntyre Collegiate in Winnipeg, and John Pritchard School in Winnipeg. At this time, the school exposures were in people who were asymptomatic at the time that they were in the school. And again, reminding us that we are seeing this virus circulating, and it's necessary to always practice those fundamentals and all the protocols that have been put in place. We also have to remember to be kind, and that stigma really impairs our ability to address this virus. And so encourage people with mild symptoms to get tested. If you test positive, no one is blaming you. But it's the best way to protect everyone around you. And certainly encouraging Manitobans to get tested if symptoms develop, even if they are very mild. A reminder about the fundamentals, and that includes staying home when you're ill, even just mildly ill, washing your hands frequently, physical distancing when at all possible, and wearing a mask in indoor public places, especially if you can't self-isolate. We know that our actions today could have effects up to 2 weeks from now. So we need to stay up to date on those fundamentals, protecting ourselves and protecting the people around us. We've discussed employers needing to ensure they have protocols in place to ensure ill employees are not coming to work, that ill employees can stay home and do so easily. We again ask employers not to send asymptomatic employees for testing. Only symptomatic people or people who have been advised from public health to get tested should be going for asymptomatic testing. And then again, a final note on the importance of stigma and how that can really impair our ability. We're seeing some of this rise with these school cases. So I really want to ensure Manitobans are aware that stigma does not help. It hurts our chances of dealing with this virus. So be kind, and we'll get through it together. So thanks again, and can open up to some questions.
Doctor, we've had one principal already say, like, given all these asymptomatic cases, shouldn't we have people staying at home if they're a student now, if they're asymptomatic?
If they're asymptomatic?
Yeah, if they're being tested?
Yeah.
Shouldn't we have, I understand you've said before, if everyone who gets tested who's asymptomatic stays home, then nobody would be out working. But what about changing it for students?
Well, here's the thing is that I'm asymptomatic today, and I came to work, and whatever risk that brings with it, if I got tested yesterday, that risk isn't greater to the people around me. So just because you've got tested yesterday doesn't mean now that you're asymptomatic, somehow you're at an increased risk to the people around you. So, by far, we're not asking people to get tested if you're asymptomatic. So that's number one. But if I came to these people who are asymptomatic, if they weren't tested, they would be at school, and they would continue to be at school until they became symptomatic. So just the fact that you got tested when you're asymptomatic doesn't increase the risk to anyone.
Mr. Health Minister, we are hearing broadly that the cohorting isn't working well because students are mixing in washrooms, at recess, there's not enough room. Teachers are saying things like, it would have been great to practice this for a while. What would you say to the notion that the cohorting isn't working?
I would say that everyone's working really, really hard out there in schools, administration, teachers, and students. Anecdotally, I can tell you, because many of us are hearing from people that we know who are teachers, and we're interacting with them over the weekend, and we hear that good efforts are being made and that many challenges that were even seen last week are now being addressed. So we continue to put our faith and confidence in the people who are there on the front line doing this, but we have no reason to suspect that somehow the cohort system isn't working.
Dr. Roussin, have you taken any messaging away from those provinces that have opened schools earlier than Manitoba, a week or two earlier? Some of them are now seeing spikes in cases. I'm not sure what percentage are spreading in the schools or spreading in the community and then being brought to school. But is there a message to take from what we're seeing in Ontario and BC and Alberta?
Yeah, I mean, I think that the issue is what we've been saying is that we know this virus is going to be around. We're going to see cases in school, just like we see cases in other walks. What we have to do is have these measures in place to protect against the transmission within schools, which it certainly can happen, but all these efforts are to try to prevent that. And in these cases here, although we have now 5 schools affected, each and every case was an asymptomatic person, and which means that our screening is working, that we're not having symptomatic people back there. And in most of those cases, we're not even identifying close contacts that need to self-isolate. So I think that's the key, is that we can't let our guard down. We're going to see cases, and we just have to make sure that we've had all the fundamentals in place, so we're not going to see huge number of contacts.
And you had said recently in terms of Winnipeg that the number of contacts per case has risen sharply.
That's right.
Is that a threat as school starts now, because the people in the household or the kids or teachers themselves are having more contacts? Is there messaging you can do to get people to reduce the number of contacts that they have?
Yeah, I think that's the fundamentals. We would say now the average number of contacts per case in Winnipeg is about 5. And that was substantially lower before, down to 3 at some points in the past. But that's the more contacts per case. We know a certain percentage of those contacts will become cases themselves. So we need people to ensure they're following those fundamentals to keep those number of contacts down.
Dr. Friesen, can you explain why last week, when there was the case at Churchill, we knew that it was a student, we knew the grade, we knew the room number, and over the weekend we heard there were 2 cases reported at 2 schools with individuals with no other identifying information. Is that going to be the case going forward, and why not the transparency that we saw in last week's
Yeah,
announcement?
and so this is you know, a bit of a learning process for us. I think that when we first started getting the back-to-school plans together, we discussed at that time that we would be naming certainly the schools and the cohorts, and that was our plan. After doing so, there was a tremendous amount of stigmatizing behavior that came out. We received a number of issues from professionals indicating that they were a little bit concerned about the amount of information that was released. And so we, just like throughout this pandemic, we review our steps and look at maybe other ways. So what we're doing is releasing certainly when there's a case connected to school, we're committed to that. Anytime there's an infectious case in the school, we're going to advise Manitobans to that. We're going to communicate to that school community for sure. And if there is contacts within a cohort, then we will communicate directly with everyone in that cohort and let them know that either they need to self-isolate or that we've already identified those who need to self-isolate, and the rest we're just, out of abundance of caution, advising to self-monitor.
So can you say that at John Pritchard, it was a staff or a student?
No, that's what we're looking to try to get as much information out there to know where the cases are, but we're going to try to do what we can to try to maintain some privacy, not to deter people from going to get tested.
You said professionals, do you mean doctors were giving you a bit of blowback on the?
Not necessarily physicians, you know, just certain educators even were letting us know, and in just even, you know, in public health, as we constantly review our processes. So we got some feedback that in that instance, some of the release there was perceived by some to be too much.
But by not saying whether it's a student or a teacher or somebody there to fix the vending machines, doesn't that leave a whole bunch of people asking questions and wondering? I mean, how do you know in a school environment whether you were, you know, close to somebody who was, you know, had the virus? I understand they weren't symptomatic, but isn't that going to just invite more questions and more concern from people if they don't have?
So it may, but you know, so public health does its investigation. So public health will go look and see if there are any concerning contacts, and we always advise those specific people who have been contacts. We advise a cohort if necessary. So public health is investigating and finding close contacts, and will notify them. But I mean, they're all valid concerns, but it just, when we release the cohort, we've heard the feedback that it was too much, that it's too easy to identify people, and there's a, you know, consequence to that. Then we also hear that, you know, by not releasing it, you know, we'd like to hear that information. So both valid, but we have to understand we can't achieve both of those things. So we have to find a balance.
Can you give an example of anecdotally of what sorts of things educators were saying about, you know, the stigma and the
Yeah, just that
response?
there was a pressure on, you know, pressure on an individual. You know, there was social media posts there, and there's just concern that that releasing that level of information broadly, it's easier to possibly identify someone.
Were the people at John Pritchard and Daniel Mack tested and went to school, or attended the school in some form while asymptomatic?
Well, overall, so the important thing to know is that they were at school when they're asymptomatic. So they weren't symptomatic while at school. We've had a mix of things, and going forward, it's, you know, I'm not sure if we need to distinguish it, but there's individuals that were just tested asymptomatically, and then when their test result came back, they're happened to be at school. There's other people who were at school, later developed symptoms, then got tested, and then was positive.
So will you tell us for the weekend cases and the case today?
No, the only relevant information is that they were asymptomatic while at school.
And Minister, part of the back-to-school plan says, and I quote from your study, from your document, sanitizer, hand soap, cleaning supplies will be provided at school, hand sanitizing stations will be set up at school entrances. We are hearing in Riverview School Division multiple sources confirming that there isn't sanitizer available, and they're saying there isn't money for it. So how do you react to that?
Well, I haven't heard that anecdote this morning. I know that even talking to some communities earlier today that they're saying we have our hand sanitizer stations in place, we're cleaning desk surfaces. I'm imagining if that information is forthcoming, it'll be going to the Minister of Education's office, and then someone will be addressing that.
But there's supposed to be money from Ottawa, your folks, all this. It would be identified where the money goes specifically later on. Can you give us an update on where that additional 52 million in provincial money and, forgive me, 87 million in federal money is going?
Yeah, so we did make that commitment that we know that schools are going to incur some very significant costs to be able to make their school environment safe for students and teachers and everyone who is working there. And so that is the crux of that commitment we have made. Those school divisions will be having a series of calls for their receipts, and then there'll be an adjudication of those costs, and there'll be amounts paid. And those things, those categories will include, as you say, things like the sanitizing sprays. Maybe in some cases there's been additional classrooms built. Maybe there's been additional bus routes added. All of those will be at cost. That will be eligible.
Forgive me, has the money already started to flow?
Oh, I don't know in terms of the financial reconciliations what the call has been from education to the school divisions, whether that will be done on a quarterly basis or monthly. We could get that information for you.
Dr. Roussin, do you see a greater threat of spread being within the schools, or spread in the community and then kids showing up in the schools?
Yeah, and so the way we have our plan set up, we're trying to limit any transmission within schools. And so we're going to see, because we know there's asymptomatic people could potentially transmit it, although it's a much lower risk. So we're going to see episodes like this where people were at school, asymptomatic, may develop symptoms that evening, get tested, and they're positive. So so it's certainly possible. The way we have things set up with the distancing, the sanitation, the masks, we're trying to really limit in-school transmission.
And what do you see from other provinces that have gone back to school a couple of weeks before us, and have they managed to quell these sort of inter-school transmission?
Yeah, I haven't really seen any reports of the inter-facility transmission there, but that's not to say it hasn't happened. Yeah.
How many cases are on Manitoba First Nations right now?
A total of 3.
And do you know which First Nations?
I'm not sure if the, I want to be careful because we've agreed with our First Nation partners that they would be announcing those cases. So I just want to make sure. I'm not sure if they had announced it yet. So I would leave it to their leadership to do that.
And what kind of supports do you give to First Nations? Is it different than any other region in the province?
Well, there's a lot of support set up, a lot of excellent planning and went in with the First Nation leadership to respond to these type of things. They have a rapid response team that had been sitting waiting to go into areas like this should it occur. And of course, the province and the region would work with them to help out with any capacity issues.
A question for the health minister. So we have new data warning of the long-term impacts of students' career or future career, I guess. So because they lost the 3 months of class time because of the pandemic, are you working with any educators at the education minister on a way to make up for any of this lost time?
So I don't know what the Minister of Education has explicitly said. We know that there will be learnings from this time. Obviously, we know that COVID-19 has an impact. And that we know that even the lives of students were significantly disrupted. So I know there'll be a lot of research to follow this pandemic in those kind of areas. I haven't spoken to the minister specifically about the issue of how some of that might be made up.
Dr. Roussin and Minister Friesen, the Manitoba Métis Federation's accused you both of discriminating against the Métis in your COVID-19 response and ignoring them. But it sounds like you've got a lot of work you've been doing with Indigenous communities, First Nations. Why hasn't there been that kind of working relationship with the Métis from your understanding?
Well, I just want to say very clearly that we have been making invitations to the Manitoba Métis Federation since the beginning of the pandemic. As you say, we've worked very, very effectively with Indigenous and Inuit leadership, and we've made the same invitations to the MMF. I don't know why Mr. Chartrand is saying what he's saying, but certainly the evidence is there. incident command structure. We asked them to participate with us. We reached out to encourage the development of an information sharing agreement. We have not heard back. So that door is open as soon as Mr. Chartrand would want to walk through it. And I would invite Dr. Roussin to make any comments that he could.
Yeah, certainly. There has been some, certainly outreach from the beginning, and certainly I'm open to meet and to address any issues and collaborate moving forward.
Dr. Roussin, is the Beaver Lodge case a person under the age of grade 4?
Yeah, I don't think we're going to announce the ages of it. Where you certainly deal, letters go to the people involved in the cohort, and so we're going to again try to limit the amount of information we're.
In the MP report published today, there's, by the end of August, 83 healthcare workers. Do you know the current number of healthcare workers infected so far?
Like a current active
Total.
or total? No, I don't have that in front of me.
Should we, again, I ask often, is we've got this, we've seen the, I'm assuming that number is related to the personal care homes in August. Can you confirm that? The 14 additional people that were identified in the last week of August that were infected healthcare workers.
There's some of that is related to personal care homes, yes.
Are you, just sorry for are you still confident that the healthcare system is insulating itself as best it can? Because you made comments a few weeks ago about sometimes people may not be following the fundamentals, or there's fatigue and PPE use. Mm-hmm. Is that problem been rectified?
I think so. I think that there was, if you look now in all of our clusters, the only real update to that is that in the Brandon Health Center there, the Assiniboine area, there's one more resident that's been identified a case, but all of the other outbreaks, there hasn't been any additional cases identified.
The handouts that people receive at COVID-19 testing sites have been updated. Before they were getting ones from February that were kind of dismissive of the usefulness of masks. Well, the new handouts provide more information, but there's not a single mention of masks. It's like 4 or 5 pages of French and English, but why not include that?
Yeah, I mean, I think that at the time, our stance on masks had evolved over time, and that's why we had that in there. I think now it's just not our messaging on mask is widespread. It's not only to people going to get tested. We're telling everyone now that our advice is indoor public place, really be wearing a mask. Especially when you can't be certain that you can physically distance.
And Dr. Roos, we've got more than 40 active cases in downtown Winnipeg. Based on your epidemiological workers and the contact tracing, is there an outbreak in downtown Winnipeg?
No, we don't see really a specific link between everyone. We don't have really something that we need to target at this point, but we certainly keep our eyes on that. But at this point, we don't have a specific link between those cases to tell us that there's some intervention that we require right there.
This is the first time to talk to you since the release of the Winnipeg breakdown last week. Do you take anything from the breakdown of cases, either total or active, and how the numbers vary by region within the city?
Yeah, and so there's not a whole bunch right now that's guiding a public health intervention. I think we could see in the downtown area and the Seven Oaks area we're highest represented on that map. And looking at that, still the vast majority of cases are household contacts. And so that sometimes will tell us why we're getting a lot of the cases in certain areas, because that's where their household contacts are. So, but as of right now, we don't have a targeted intervention in either of those areas that we need, but we keep looking at it.
And if you rule out the close contacts, if you look at the initial case that might lead to household contacts, is travel still the same, the prime driver there?
No, actually, travel is, we're not seeing many travel-related cases in the province anymore. The most is close contacts to a known case, and then there's some non-epi-linked cases. So the 7-day non-epi-linked cases in Manitoba overall is 22, and there's 17 of those are in Winnipeg. And we do have a measure here on last 7 days travel-related cases as 2.
So it's not travel, it's community transmission and
And close contacts, 2 known cases. Yeah.
And speaking of close contacts, how many close contacts are isolating as a result of the beaver lodge?
Yeah, that's certainly less than the entire cohort, but we're not going to release the specific number.
So that's a number below 75?
Yes.
Thank you, Doctor. We're going to go to the telephone, take a few questions from our reporters on the line. From CBC Radio Canada, Catherine.
Hi, Catherine Logan from CBC Radio-Canada. A few probable cases were reported in First Nations and reserves over the weekend. Firstly, have those been confirmed cases? And do you have any new cases to report in First Nations, and how many?
Yeah, so we have 3 confirmed cases at this point.
So no new cases.
That's right, not living on a First Nation.
Perfect. And then how concerned are you that we're now seeing cases popping up in the north? When what concretely is the province and public health doing for that?
Well, I think right from the beginning of the pandemic, we knew that remote, isolated communities would be at risk should the virus be introduced. And so we moved very early in the pandemic to the northern travel restrictions. Our response early on allowed us to loosen those restrictions, but as we saw case numbers increasing, we re-implemented those northern travel restrictions. You know, we've worked quite closely with a number of our First Nation partners and, you know, trying to have plans in place for responding to cases should they occur in the remote north.
From City News, Jonas. From City News, Jonas. From Global, Will.
Good afternoon, everybody. My name is Will. I'm with Global. First question for Dr. Roussin. With the handful of cases we've seen now on First Nations communities, I'm just wondering if you can tell us, are there any more measures that we anticipate may be implemented because of this, or any other sort of action being taken?
So yeah, I mean, you know, our public health response is, you know, we always have options available, and we'll review the current situation and see if there's any other measures that are required. As at this point, there isn't any, you know, other specific public health orders that are contemplated. We do have, you know, a rapid response team that has been sent, you know, from the First Nations working group developed this work, and it was, you know, a tremendous amount of planning. And now this has come into effect. So there's a lot of testing going on. There's a lot of follow-up. There is some work with the province and the region, but there was a lot of planning done with our First Nations partners to be able to respond to this.
Okay, thank you for that. Second question, with fairly regular increases in the Winnipeg health region here, I'm just wondering if you can go into a little bit more detail about, in your research, the information that we have, where are these cases coming from? Is it a lot of community travel? What do we know?
Yeah, so not a lot of travel, but there is a lot of close contacts to known cases. We've seen that as the major driving force right now is close contacts and known cases, but we do still see that we do have numbers of community-acquired cases, those non-EpiLink cases, so cases that we can't link to either travel or to close contact, and we mentioned that there has been 17 such cases in the last 7 days in Winnipeg.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. I was wondering if you could tell us if the government knows what the source of the case at Ecole New Era here in Brandon is and what it might be?
So we don't really speak about specific details about about a specific case. So we'll speak broadly about community transmission and travel related, but we don't link it to an individual.
Okay. My other question was about the Carberry Health Center. Does the government know how COVID-19 entered that facility?
Well, I think it was with a client that was being cared for there. So I don't have any more specific details on that.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Question regarding, and I know you just answered it, regarding the Ecole New Era school, but do we know where these cases are coming? So all 5 of them in schools now have been labeled as asymptomatic. So do you know how they're getting into whoever they're getting into in the schools and why?
So we have, when we do a investigation of a case, we do certainly a contact investigation. We try to determine who they may have been in close contact with so we can get those people to self-isolate. We also do an acquisition investigation and look for where they may have acquired it. So we do know for most cases. Some community-acquired cases, we won't be able to know that. But it's what I could say is that for these cases, there was public health was being public health advice had been followed, and that they were asymptomatic at the time that they were in school.
Okay, and maybe I'll follow up to that then. Have all 5 of these cases turned into symptomatic cases, or are some of these, whoever they are in these schools, are they still asymptomatic? Can you say that?
There's a mix that there's some that are asymptomatic testing and came back positive. There are some that were asymptomatic while they're at school and then became symptomatic and got tested. So there's a mix.
From CJ 104, Bill.
Good afternoon, Dr. Roussin. You talked a lot today about stigmatization and some changes the province is making to prevent that. I wonder if you could talk to us for a moment about an incident in the Swan Valley. I can't think of anything more stigmatizing than a convoy of RCMP and public health officials serving a ticket. You yourself spoke about it when that ticket was issued. We're now hearing from public health that everything about that ticket was wrong and shouldn't have been issued. Will the province be doing anything to walk that back for the family affected and try to destigmatize them?
Well, so I mean, the expectation is what I said when we first dealt with this ticket, is that we should be certain that it's required, and that it shouldn't be our first step. Our first step should be to try to work with that individual. But again, this shows that we're always looking at evidence as it becomes brought forward, and so in this circumstance, evidence that was brought forward following the ticket showed that it wasn't required, and so then it was pulled back. So from that, the information subsequently received made us revoke that ticket.
As a quick follow-up to that, we've heard from numerous individuals in the affected area saying they will no longer consider being tested for fear of a similar incident happening to them. Have you seen that on a province-wide basis of people fearful that they might suffer the same fate and as such don't show up for testing even when they are symptomatic?
Well, this is what we talk about when I mention stigma at all these conferences, because we when we bring in public health orders, often the first question we get is how are we going to enforce them, and when we hear about the cases that say we're not isolating when they were symptomatic, we get questions about are we going to levy any fines against them. All of this is measured because we know that the more we deal with things like fines, the more we deal with releasing specific information, that may deter people from getting tested, and that's going to decrease our ability to manage the pandemic. So certainly, we have to have the ability to enforce things. It should not be our first step, and certainly my expectation is that we be quite sure that it's required given the circumstances.
We'll take one more shot at Jonas from City News. Are you back with us? Okay, we go back to room 68.
Dr. Roussin, what advice would you have to schools to prevent children from mixing on the playground at recess and lunch between their cohorts?
So I'd say that these are, challenging times, and so being outside, the timing is important, and how they can arrange those times outside. I think the outdoors type of exposure, as we know, is much less of a concern, but we should still try to maintain those cohorts as best we can. And same thing with lunch. It's the spacing. So we need to try to keep that spacing as much as we can. We need to remind people. We need to remind adults from it. We see that we've lost some of our touch with the fundamentals, and I think it's challenging. And we can't reduce our risk to zero, but we can keep putting things in to reduce our risk.
So it's challenging. How much easier would it have been if there was more room?
It's hard to know. I mean, I think that space is certainly relevant to being able to physically distance, but how much space that is and how feasible that is, it's wouldn't be something I can comment on.
What's the procedure for getting these kids back to school? Do they need a negative test before they come back? Is it a certain amount of time before they come back?
It's time. So it's 10 days post onset of symptoms, and no longer feverish. And a clear improvement in their symptoms.
What about the asymptomatic cases, though?
Yeah, then it'll be 10 days from the date of the test.
And what do you think if they come in on the screening? If they said they've been what do you think schools should say to the kids if they come in on the screening and they said, "Look, I'm asymptomatic, but I've been tested"? What should the schools do in that instance?
Yeah, I don't. Right now, our screening tool doesn't exclude asymptomatic people who have been tested. So I advise to keep following our screening tool, which can change over time. So to update that over, frequently.
Dr. Roussin, what are the implications of the switch to clinical diagnosis for probable cases? Are those tracked differently at the province for future funding, for ongoing monitoring for research, et cetera?
No, it's just really just the if we're looking at say, for instance, a individual, we have a case in a home, and then somebody else later develops symptoms to COVID, we're going to call that a probable case until proven otherwise. Just because we want that person self-isolating right now, we want them treated as a case until maybe something else comes up to make us change our mind.
So that individual, in that scenario, that individual will be tested later and become confirmed?
We would advise testing. If that person refused testing, then we would have them self-isolate for 10 days since the onset of symptoms.
Gotcha. And then, but in the data where it's stored, do they get an asterisk as a probable? Is there any, are they treated like every other confirmed? Because you often say lab confirmed cases, even though there are probable clinical diagnosis.
That's right. Yeah, I don't believe we have very many. We've had people who are, we would say, your probable case, they get tested, it's negative, then we remove them from our file. I don't think we have many cases that have just remained probable. Almost always they end up getting confirmed as cases or otherwise.
Thank you. Oh, go ahead.
Are spit tests or throat swabs anything that you're looking at?
Yeah, we're certainly looking at all testing modalities. We know the nasopharyngeal test is the most sensitive test right now. It does have, staffing implications. You have to have a trained person doing it. Some people experience some discomfort with it. If we could get to a sensitive saliva-based test where people do even self-collection and bring it back, it would certainly be quite important for us. Right now, some of the evidence shows that the current assays may be about 30% less sensitive right now, but these things kind of change over time.
Less sensitive meaning less accurate or less?
Yeah, less sensitive is more chance of a false negative test.
And where are we at with A, the app, and B, the serological testing?
So the app, we are still working with Canadian Digital Services, Health Canada to look at the the regional implications for that. So we're still working with that. There isn't really only Ontario and Newfoundland are signed up right now, and so we're going to continue our progress on that. Serologic tests, we don't have a seroprevalence study that's yet started here. We're still waiting on some of the kits for that.
Manitoba's numbers were 0.56 though last week from Canada Blood Services. It was like 0.56%.
They did the Canadian Blood Services did one. We have not completed a
Right.
seroprevalence study. Yeah.
And
What about parents? What do you say to them, like when you hear these cases, it seems like we've had one almost every day, it's 5 days of school, 5 cases. A lot of parents, I spoke to a principal today, he's like, all he's been doing is fielding calls and emails from parents. What do you say to them?
Yeah, I mean, I think we have to expect to see cases. We see cases every day throughout the province. These are cases that have not been acquired in school, so none of these cases put into question the protocols that we have in school right now. And there's a couple 100,000 students, so we're going to see some cases in there, but we want to do what we can to prevent transmission within schools, making sure the schools are safe.
just to follow up from Steve's question much earlier, could you draw any epidemiological conclusion by the fact there was the highest rate and the largest number of cases so far in Seven Oaks Health Region? Could you tie that to anything?
Not really. At this point, it's been over quite a period of time, and again, this is just where people live, and not necessarily where they acquired it. There might not be any connection as to a bunch where they acquired it.
I'm not interested in, I'm not talking about like this is a dangerous area, but I mean, is it, you have some underlying backgrounds on your health community areas, so is it more healthcare workers working up there? Is it younger people? Is it people in specific ethnic backgrounds? People in like those kinds of conclusions?
Yeah, nothing specific. There's all categories in all of that, in pretty much in all the areas. But there isn't one thing that stands out where it is. Yeah.
Will you be able to make the background data that you folks get from Census Canada and then put it into your community areas? Will you be able to release that so we can then over time do the kinds of regression analyses that we've done in other cities where we have areas and then the background Census Canada data?
Mm-hmm. I don't know for sure the answer to that. We can look into that.
There's been a suggestion by some that the cases are linked to socioeconomic status. And I noticed that, active cases seem to be in lower income areas currently, but there are places such as south of Assiniboine, higher income areas that had a lot of cases earlier on, and in the total case count per capita, that's a pretty hard-hit area as well. So is there any socioeconomic analysis at this point to be drawn from the data?
Well, not necessarily anything conclusive at this point. I think that, we would say that the lowest quintile of income based on the census is greater affected. Not necessarily to a statistically significant level, but certainly greater. And it's unfortunately what we see with many conditions, and we've seen that in other areas, right? So we have a novel virus that's introduced with almost universal susceptibility, but we still see certain groups that are greater affected by it, and usually socioeconomic status is one of those things.
Last one. But in this case, it may not be. Because again, I go back to South Assiniboine, and the cases are mostly resolved, or
well, I would say that right now our evidence isn't conclusive for that. Okay. But if we look throughout the world and Canada, we do see that disproportionate effect in this and many other conditions. So I would expect to see that.
Thank you very much.
Thank you.